States, and in Indiana we had 6. We had Evansville, we had 3 in Indianapolis, and Sunday, which is, you know, not a busy day for people to get out and rally, 600 people showed up for a candlelight vigil in Indianapolis. Most of them were clergy. And they are determined that people should have health care. Wouldn't it be wonderful? This is the 44th birthday for Medicare. Last week, the 30th of July, we have our 44th president. Wouldn't that be a coincidence if we can expand Medicare to full coverage for everybody and when we have the 44th president? It seems to be a signal to me, and we are continuing to celebrate Medicare's 44th birthday all through August. You know, here you are today, and I'm happy you invited me to participate. Tuesday, I'm going to be doing an event in Indianapolis at the Allison Local Union, Local 933, and they always have 250 to 300 people. And then the week later, we're going to be doing one in South Bend at Local 5. We had it scheduled for Wednesday last week, but when President Obama was coming to Elkhart, they said, we want to go there, so we're going to have to cancel you out. So we said no canceling. We postponed it 2 weeks. That'll give us more time to rally. You've heard so many of the stories. Let me just divert a little bit to prescription drugs. Prescription drugs is one of the most expensive things, going up more rapidly than other things in the healthcare system. And many people, even those with insurance, aren't getting their prescriptions. They aren't taking them when they should. They're cutting them in half. They're skipping times. Now this is people with insurance. Those without insurance aren't even going and buying their prescriptions. We learned before Part D, it's been mentioned earlier, before Part D was passed, we were taking people to Canada to get prescription drugs. Not because I wanted to avoid buying drugs in the United States, but because people who needed them, maintenance drugs, some 10 and 12, 13 prescriptions, were willing to go to Canada where they could get a 3-month supply for what they paid for 1 month in Indianapolis or Fort Wayne. On one of the trips, had a story that I remember. This was in 2002. One of the ladies on the trip that I knew said, Elmer, this one woman from Speedway is only going to get 1 prescription. And I said, why? Geez, she can save so much money. Well, her prescription is so expensive. And I didn't know the lady, so I didn't talk to her about it. But on the way back, at a rest stop, I asked her, said, well, how did you do on your prescription? She started crying. She said, Elmer, in Speedway, I pay $711 a month. She had cancer, and this was a serum for her cancer. In Canada, I got 3 months for $693. You know, I tell that frequently, and I still, when I tell that, I get a little moisture in my eyes, because it's criminal that somebody who needs something to live, not to make him feel better, not to get rid of a headache, but to live, has to pay that much to survive. You heard us, Dr. Tom Hayhurst told about people dying for not getting care. You're aware that our state has privatized food stamps and Medicaid. And we have a private for-profit company deciding who gets these services and when they get it. Well, in Evansville, Indiana, we had a woman who had been on Medicaid for several years. She was denied her benefits. She had an appointment to go in, but she couldn't because she was going in the hospital. She called and told why she couldn't be there, but they canceled her insurance. She fought for 6 months with help of Senator Becker, who is a Republican, who works with us and helps us, and we are happy for the Republicans that work with us. And the area agencies on aging, we're helping her. And guess what? March 2nd, she got approval for her Medicaid. But on March 1, she died. She died the day before. Now, fighting 6 months for something she was eligible to that the state had stopped. This health care plan that is being promoted in Congress right now, H.R. 3200, would include the Class Act that Senator Kennedy has in his bill in the Senate, and that would extend long-term care benefits. They don't talk about that, but that would eliminate some of these things where the states may decide to privatize things that knock people out of benefits. It's a shame those kinds of things happen. The disturbances that are going on, I got wind of this last Thursday, and I wrote an editorial a release to all the papers in Indiana, and I haven't had anybody tell me they saw it written in the paper yet, saying that we can have differences of opinion, but we need to be civil in our discussions so we can talk. Maybe they have a good idea. You know, they tried to help me. When I drove in, I saw the crowd over in the other park, and I thought that's where I was supposed to go. So I went over there, and they saw my shirt, and they said, "How old are you?" And I told them, "I'm 83. And they said, "Oh, you shouldn't be going over to that other place. They'll want to kill you." You know, I tried to explain. I read that stuff where they say, page 425 in this new legislation. Well, you know what that is? Back when the other Bush was president, we pushed through legislation that you could designate what you wanted done if you got into a coma and if you were brain dead, that your kids wouldn't have to decide whether to pull the plug or not. We worked to get that, to pass that, and President Bush, the first Bush, signed it. That is in the law that we can do that. Page 425 in the new bill says if you want to counsel on that, the Medicare program would pay for that once each 5 years. So it's not they're going to counsel you on what's available and what you can do. And I sure don't want my kids or my grandkids having to decide whether to pull the plug. When the time is there, then it ought to be down what I want done, and they ought to do it and not put that burden on the kids. There's the whole lot of misconception that they've trying to write into this, into these issues. And some of the congressmen are not having as many of the rallies. In fact, one of my friends went to see Congressman Pence's office, who's against this bill, incidentally, yesterday morning, and wanted to know when he was having a rally. They said his next rally is in September 12 or sometime after Labor Day, and they said he just had one last month. Well, usually he's got a bunch of little ones around, and I guess he's even afraid. But I joined Ray McAllister in saying, for us, don't disrupt somebody's event. They're not convincing any of us to kill 676. They're not going to convince any of us to be against H.R. 3200. And we learned a long time ago in negotiations, you don't compromise until you get to the point you're going to have a deal.